Well, hello, everybody. We're here with a special guest, Barbara Tritz. Welcome. Thank you for joining us.
Well, thank
And I
you.
want you to, yes, I want you to just introduce yourself. Just tell us a little bit about you and what you're passionate about.
Well, this I have so many dental passions, but I am a biological dental hygienist, and I work with Isabel, and we are a state of the art, 21st century preventive dental office. And it is my passion. It's the way dentistry and dental hygiene should be done. We are looking for the root causes of dental diseases. We are looking for how do we prevent disease before destruction, before the damage occurs. What do we need to do to help our patients to be healthy? So I have been on this path for over 40 years. And, my first year as a dental hygienist, I was a buff and go hygienist. I saw 10 patients a day, 50 patients a week, and I wasn't a healer. And that's why I went into healthcare, was to help my patients to be healthy. And I found that I couldn't do that as as a traditional hygienist. And so I've been on this path ever since then, looking for how how do we help healing? Because everything starts in the mouth. If the mouth isn't healthy, the rest of the body isn't healthy. But if the rest of the body isn't healthy, then the mouth isn't healthy. So what do we need to do to encourage and be a part of the dental healing team? And I call it preventive preventistry instead of dentistry. You know, how what can and the hygienist is the best preventive specialist there is, and we see the patient before the damage occurs in the rest of the body. And so I've used a phase contrast microscope. I use salivary diagnostics. I use every tool possible, and we're going to talk more about that. So that's my
Yes,
passion, and that's what I do.
I love it. And on top of that, you did myofunctional therapy, which is really important. Can you explain a little bit about why is it important for people to go to a myofunctional therapist?
So myofunctional therapy teaches our patients how to breathe properly, how to use their nose. Something so simple, we should do this automatically, but we don't. We 50% of us walk around our mouth open, and especially when we had all those masks on, everybody's mouth breathing underneath there. And when you mouth breathe, that sets up a domino effect of improper tongue rest posture, improper facial development, and then you're leaning forward, you're trying to open your airway by putting your head forward, and it sets up a whole cascade of problems, leading to heart attack and stroke and digestive disorders and muscle problems and autoimmune issues. And so just getting the tongue in the proper position, getting the patient to have the proper oxygen carbon dioxide exchange, you're sleeping better, you're breathing better. Oxygen is the basis of our health. So myofunctional therapy teaches our kids and our adults how to breathe, where to put their tongue, how to swallow, how to chew food properly, all of these basic things that we should do intuitively, but we don't. So so that's part of the other half of dentistry. If we're mouth breathing, then that drops the pH. That contributes to cavities and gum disease. So we can't heal unless we deal with the whole patient. And myofunctional disorders are part of that. We have to be aware of that.
Correct. And a lot of people don't realize that they're mouth breathers or that they're having issues with their tongue, the positioning of their tongue, and they start having some issues with sleep apnea. They're
Mhm.
fatigued, they're not functioning properly, and it just starts because their tongue is not in the right position. So it is very, very important. Let's talk a little bit about that pH and that acidity, because you
Mhm.
see every single patient gets tested for their pH. So, what is it that you can share with people so they understand a little more about having a more neutral pH rather than having an acidic pH?
That is correct. Again, something so simple, but so critical. The mouth likes to have a pH of between 6.8 and 7.4. Ideally, neutral at 7.0. That's ideal. But when we mouth breathe, then that stops the flow of saliva. And when the pH of the mouth is at 5.5, the minerals start flowing out of the enamel portion of the tooth. But it only takes 6.7 to start getting decay along the gum line. So for some people, if they have a lot of recession and they're a mouth breather, that drops the pH. There's no saliva to remineralize the teeth. The plaque gets sticky, it gets acidic. The bacteria love an acidic environment. And the bad bacteria, that's what they thrive on, is that acidic environment. And then they grow a more acidic environment because the bacteria are excreting acid. And so then more minerals flow out of your teeth, and that sets up a perfect storm for root decay, tooth decay. And, we're fighting tooth decay. And so it's important that we use all our tools. And natural saliva with a pH of 7.0, that's our best tool. So, monitoring the pH. Are we mouth breathing all night? If we're mouth breathing and there's no saliva, then you wake up with a really acidic mouth and a dry mouth. How many of our patients complain that they are having to peel their tongue off the roof of their mouth because they're mouth breathing all night? So, so
Yes,
I have a
that's
fix
true.
for
Yes.
that.
And then also with your salivary testing, you have found a huge correlation between certain bacteria and periodontal disease and all the risks that periodontal disease has at a systemic level. So what do you think that it would be a good idea for people to know, and why is it important to find out about what kind of bacteria they have in their mouth?
So, doing salivary diagnostics, every patient should be tested. We need to know what we're dealing with because a dental office is it's a medical office for the mouth. And when you go to see your medical doctor, what's the first thing they do? They say, you need these tests. Go see the lab, go have some blood drawn. And dentistry needs to get on board with that. And we need to know, even for children, what bacteria are we dealing with? We know that 99% of the bacteria in the mouth are healthy. We need the bacteria there. We need the fungus. We need the viruses. They have a job to do. They're really important for our whole body. We are more microorganisms than we are human, and but we've got to know what we're dealing with. And so in a 5-year-old, when I see spirochetes, I know we have a crisis brewing. And so doing salivary diagnostics, using the microscope, I mean, that's a great first tool. I take a plaque sample on every single patient, no matter if they're 2-year-old or 102. I want to know, baseline where we are with their oral bacteria. And then from there, salivary diagnostics, because there 1% of the bacteria and pathogens in the mouth are bad guys. They're the ones that cause disease. They have found, because the mouth, the bacteria translocate. We inhale those bad bacteria into our lungs. They're part of aspiration pneumonia. We swallow those bacteria and other pathogens, and that leads to stomach ulcers, stomach cancer, and pancreatic cancer. And then every time we chew, every time you get a dental hygiene visit, every time you have a tooth extracted, all those bad bacteria in the mouth go right into the bloodstream. And they have found our oral bacteria in the atherosclerotic plaque, in the heart, and in the brain, and huge connection to dementia. So if we can recognize and identify our patients before the bacteria take over and really practice that preventive dentistry, then we can affect systemic change and help our patients, guide them to health. So salivary diagnostics, an easy test. I have my patients spit into a tube, we mail it off, and I get a lab report. And so we can work at preventing systemic problems orally.
Yes. And do you have a case in mind that you remember that when you did this sample of their plaque, they had really big activity of that negative bacteria, and then maybe you did a salivary test and there's just more information that was correlated with some systemic conditions that they were having?
Oh gosh, so many patients. You know, um, yes. I mean, having gosh, great question,
Because we
Isabel.
know we see like amoebas. We have been seeing amoebas, and
Oh,
that's a big red flag that there is something systemically happening.
you
Or
know,
patients that have maybe
exactly.
Lyme disease, they also have a lot of things that can be affecting their mouth. And we could be the first professional to realize that there is something else bigger than just problems with the gums or the tissue or the teeth, but there is something else at a systemic level that is affected, or even hormonal imbalances.
All of the above. All of the above. I guess one case that really stands out is I had a little girl who was having a lot of cavities, and the amount of her decay and the speed of her decay is was so aggressive. It's like, what is going on? And so we sent her for lab work and blood work, and lo and behold, she had leaky gut as an 8-year old, and she wasn't absorbing her nutrients, and and her blood work showed that she was devoid of vitamin D, and and then I looked deeper, and she probably was on the road to osteoporosis with all of the minerals that she wasn't absorbing. So, even in children, this is really critical to do. And having teeth that are bombed out in 6 months is not natural. There's something greater and systemic going on. So,
That's amazing. And isn't it incredible that we can do something like that for this young kid
mhm,
and prevent future problems as when this patient becomes an adult and start dealing with really difficult conditions.
mhm.
And this is something that we can detect early. And this is one example of many,
Oh
because
yeah,
there is a lot of things that we see that are affecting the patient's mouth, but it is a reflection of what's happening with their systemic condition.
yeah. It's time to reconnect the mouth to the body. This is just a barometer for a bigger, bigger, bigger systemic issue. Diabetes, tooth decay, and diabetes. I That's why it's so critical to work with a primary care physician, because these signs are just signs, and slapping fluoride on a tooth, it doesn't work.
Is not going
You
to
know,
be doing,
yeah,
is not going to help.
not at all. The best predictor of future decay is current decay. So if I have somebody with a cavity, I mean, I can plug it, but that doesn't stop. The bacteria is still there. The root causes, and that's what we need to go deep, dig deep for those root causes. Is there a leaky
Mhm.
gut? Is there mouth breathing? Is there a drop in the pH? Is there an acidic environment? Is there acid reflux? Those things are all show up in the mouth. And why do we have acid reflux? Well, because we're not breathing at night, because we have sleep apnea. So it's just this domino effect, just boom, 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 that just, you know, I put on my detective hat, and, looking at the medical history, really digging deep, and then getting those lab results, the salivary diagnostics, and what good bacteria do we have? What are we dealing with? So it's an exciting time to be in dentistry. We have such great
Yes,
tools.
yeah. It is something that a lot of people ask me, "Well, what do you mean when you talk about a more biological integrative approach?" And it is all these things that we do to make sure that we're looking at the root cause and not just patching things here and there.
Yeah,
We are definitely going and preventing not only oral health problems, but potentially systemic problems or bigger chronic diseases that can be affecting the patients in the future.
Exactly. It's exciting.
So,
It's I get to finally be the
yes,
healer that I went into dentistry to be. So it's
exactly.
and
So, what
having
would
the
be
tools.
like recommendations that you can give patients to make sure that they are doing the right things to prevent bigger problems?
Well, salivary diagnostics, and there are companies that you can order the salivary diagnostic kit yourself. You don't have to have a dental office recommend it. So there is that option. Finding a dentist and a dental health practitioner, hygienist who understands this. As a member of the International Academy of Oral Medicine and Toxicology, that's the group that we are members of, and finding someone, we have international members. So there are dentist offices throughout the United States and the world that practice this way. They're not a lot. That is true. You have to travel to those offices, but they're worth the trip because if you really want to be healthy, it's so much more than just which toothbrush to buy and what dental floss and what toothpaste. This is going to take a deep dive to figure out what's wrong, how do we fix it, and how do we maintain it, and how do we prevent it, and especially in children, you know, using a microscope, I can see if a 5-year-old has spirochetes, and spirochetes are in the brains of dementia patients in 90 to 95% of the autopsies. So, what if by using the microscope, by using salivary diagnostics, we can change the projectile of cognitive impairment? I mean, that alone would make it so worthwhile to have a microscope in every dental office, let alone, for all the other reasons too. So you know, so finding a dental office that understands the value of salivary diagnostics, that's key. Finding a primary care physician that will work with your dental office, that's key. And then food. It starts with food, it starts with oxygen. So I tell my patients, eat the rainbow, eat a healthy diet, get sugar out of there. Not just because sugar causes cavities, but sugar causes an autoimmune reaction. And sugar stops the bacteria. Uh, the, the tooth tubules have a fluid flow, and sugar stops that proper fluid flow. So now we get backwash from that acidic environment down the tooth tubules. So, being mindful of what we eat and then getting that plaque off every 12 hours so that we have a good kind of clean slate for the good bacteria to grow. Eating prebiotic foods, eating probiotic foods, and feeding the good bacteria. We have to nourish a good garden of a healthy microbiome, not a disease microbiome. And our standard American diet is aptly named SAD, our SAD diet, because it feeds the bad bacteria and then the mouth breathing. So it's a whole bunch of stuff that we can do preventively, and it's not just which toothbrush to buy.
Exactly. And a lot of people they say, but I brush twice a day and I floss
Yeah,
every day, and they're still having issues
yeah,
with their gums. But then we go in there in that specific area, for example, that they're having issues, and when you find spirochetes, okay, there is something going on in there.
yeah.
It needs to be, of course, clean, but then maybe extra tools that they need to start using to prevent it. Maybe using the water pick and
Hmm.
putting something in the water pick that is specific for that situation. So,
Exactly.
what are some of the things that you recommend? Like, in addition to the flossing, brushing, tongue scraping, cleaning the tongue is really
Yeah, tongue
important.
scraping. That's twice a day.
Just tell us a little bit about what that experiment that you were doing.
So I was taking some plaque and putting it on a microscope slide, and then I was also taking my tongue scraper because I clean everybody's tongue after. After everything else is done, I ask permission. Some people don't like it, but I scrape their tongue. And I took some of the plaque from the back of the tongue and put it on the microscope slide. So it was right there next to under a different slide cover. But you could, when I looked at it on the microscope, there was a definite correlation between what's underneath the pocket and what's on the back of the tongue. The same bacteria. And you know, the back of the tongue is, just another area that we really need to clean. That and the tonsils. Plaque sits on our tonsils, the roof of our mouth, our cheeks, dental appliances, removable appliances, all get the same plaque biofilm. And so cleaning the tongue and looking at it under the microscope just reaffirmed that. So, a tongue scraper is absolutely essential. It should be, it may even be more important than a toothbrush, maybe. Um,
I imagine you have all this aggressive bacteria in your tongue and you're swallowing multiple times a day.
mhm,
All this bacteria is going into your gut,
yeah, yeah,
spreading
exactly.
all over the world, all over
And
the
your
body,
lungs too. I mean, you're breathing this.
in your lungs.
Yeah,
Yes.
yeah. So, it's a critical tool. I also really love water picks, and water pick makes an electric toothbrush water pick combo called the Sonic Fusion. So, one and done. Especially for people who don't have that dexterity. How flossing properly is really hard, and most people don't floss anyway. So let's do something, that's easier. And that's where, everybody brushes their teeth. Let's use a toothbrush water pick combo. It takes just a moment to set it up and then irrigate and brush at the same time. And then I love a little baking soda in that water pick so that we raise the pH. Because again, it's that pH. It's when everything gets below 6.7 that things start to go haywire. But you've got to flush and clean the tank when you're done. You can't just use it and stop because it could clog the tank. I do love those little interproximal brushes. They look like little Barbie bottle brushes. And I have my patients dip that in ozone oil, and you can order that on Amazon. Ozone kills bacteria, fungi, parasites, viruses. And so if you can dip that little brush and work it in between the teeth, you're disinfecting, you're changing the microbiome, and and cleaning at the same time. You're disturbing that plaque biofilm. You're always going to have plaque. Plaque is supposed to be there, but it's supposed to be healthy. And
Mhm.
but it's when it becomes dysbiotic, when you're mouth breathing, when you're eating sugar, when you're eating crappy food, that affects your whole autoimmune system, and then the plaque becomes dysbiotic, and that's where disease starts. So by raising the pH, by disinfecting, by killing the bad bacteria, because ozone is just oxygen. And the bad bacteria are anaerobic bacteria. So let's raise the pH, let's put some oxygen in there. Then we don't kill the good bacteria, we just kill the bad bacteria. Um, so I like that tool. And then nose cleaning. Nasal hygiene is as important or more important than oral hygiene because if you can't breathe through your nose, then we're mouth breathing. And then when we're mouth breathing, that again drops the pH and starts that whole cascade. So cleaning your nose, something as simple as that with clear nasal spray or a saline sinus spray, but being cognizant of nasal breathing and cleaning your nose. There's a biofilm in your nose as well. So, we gotta look at the whole head, not just the teeth.
Yes, and it creates a snowball effect, right? If one thing is not okay, then it affects the other
Exactly.
area.
Exactly.
Yes, that's incredible. Um, any pearls in regards to maybe vitamins that the patients will should be taking or checking just to make sure that their oral health is is going to improve or is going to be balanced?
So the fat soluble vitamins are my critical vitamins. Vitamin D3, vitamin A, vitamin K2, and then vitamin E. Our odontoblasts, that are our healing cells within the teeth, need fat soluble vitamins. So we also need to eat fat so that we can digest our fat soluble vitamins. So our patients that don't eat animal protein and don't have that ability to dissolve the fat soluble vitamins are at a disadvantage. I see a higher decay rate in our vegan patients. So I encourage them to, be a little more open. If you want to be healthy, you need some fat so you can dissolve our fat soluble vitamins. Vitamin D3 is critical for sleep. Our sleep apnea patients, they need to up their vitamin D. The best combo of vitamin A and D3, because they work together with magnesium, is cod liver oil, fermented cod liver oil. Now, I know that's not everybody's favorite flavor, but if you want to be healthy, that's the most natural way, and you get the right proportion of A to D3. And then vitamin K2 is critical as well. If you have tartar buildup, that means that you are low in vitamin K2. If you're building up tartar back here, you need to up your vitamin K2. K2 is probably the fountain of youth. K2 tells the calcium in the blood where to go. And if you're low on K2, then that calcium goes into your arteries and it's responsible for hardening of the arteries. And then it is also responsible for your tartar buildup. And so if you've got tartar buildup, increase your vitamin K2. And then magnesium. Magnesium is so critical for our mitochondria. We've got to feed our mitochondria because that's we're getting down to the inside of the cellular level. And having a healthy body requires we have healthy mitochondria. And the mitochondria are our energy cells. And so if we're not feeding our energy cells, the thing in the cell that makes energy, then we get sick. And so magnesium is critical for that. And then having bioavailable copper, and that's part of it as well. So, and that's where to have bioavailable copper, we need to eat beef liver. So that's the foundation of health. And we can't have a healthy mouth if we don't have the important vitamins and supplements. And feeding those cells is critical. So those are just some.
Amazing. Yeah, this is super important, super important.
Yeah.
And we see that often in patients that have low vitamin D, that they
Hmm.
have high cholesterol, high triglycerides, and their healing is not the same.
Yeah.
And
Exactly.
also with the animal protein is really important. I see the difference between the patients that are vegetarians that don't eat any animal protein or vegan versus the patients that are more carnivores and they do eat animal protein. The healing is completely different.
Yes, it is. Yeah. We have
Yes.
to have the building
Very,
blocks for health, and that's
yes,
you know we can't just heal without them. So
correct.
yeah.
Yes, yes. Can you please let us know? She has an amazing blog where you can find a lot of information that is really important. Can you please share that with us?
I would be honored. My blog is queenofdentalhygiene.net. Queenofdentalhygiene.net, and I'm working on upgrading it. So that's in the works and should be happening in the next few months. So I'm excited to I have over 100 blog articles on everything from tooth decay, gum disease, airway, breathing, sippy cups, all just the foundations of health, oral health. So I invite your listeners to come and check it out.
And it's incredible because she even has links of products that she recommends. She has tested and recommended to patients. So you have very easy access to go and find those links and just get the products that she recommends that are just incredible and very important information, things that you probably didn't even know that are important for your oral health and for your general health.
Well,
Well, thank you so much, Barbara.
my goal is to share healthy information and things that you're right, people just don't know exist. So I thank you for this wonderful opportunity, and I invite your listeners to contact me if they have questions.
Absolutely. Thank you.